COVID-19 was making its way across the globe. Medical professionals had to change the way healthcare was working to ways never thought of.
So what was that change like? And looking back, what is different between now and then?
Well, joining us this morning from Owensboro Health Regional Hospital is Dr. Mrichael Kelley. Good morning, doctor.
Good morning. How are you?
Doing great. Thank you. So what we want to check in with you here is, what was the process to even begin helping patients with a virus that so little was known when it first arrived?
Sure. Well, this goes back 2 years, and I was alluding earlier today that on March 13th, which happened to be a Friday the 13th, 2 years ago, we really started to hit the ground running. So at that time, as you mentioned, we really didn't know much of anything. People walked around and were worried if they could touch a surface. Did they need to wear masks, goggles, an N95? What should they do? Physicians at that time were coming home from work, and their spouses probably told them to disrobe before they came in, as well as other healthcare professionals. So there was a lot of unknowns, as you mentioned, to what we did in the beginning of all this to try to protect ourselves, protect our patients, and protect our team members. So that's kind of how we started out with that unknown. We knew that we needed to create a process for testing, but we really didn't know how we were going to test. We knew that we needed to create a process for isolating people, but we didn't know what those parameters would be yet. So there was a lot of scrambling and a lot of collaboration among ourselves, among other facilities in the area, nationally and beyond, to kind of look at the data, see what was out there, and try to gauge what was coming at us and come up with a solution to the problem. So there was a lot of unknowns there, but I think people coming together at that time, everybody was on the same page, and that was pretty powerful in moving things forward, as you've seen over the last 2 years.
Now, you all ran a huge vaccination clinic there when vaccines arrived, and how did you handle such an influx of people wanting a vaccine and the likes we haven't seen in decades? And I got my vaccine there. I think you did as well. It was a very, very detailed process of how you guys handled that.
Well, there was a lot of people that came together to work that out. So one of the things we had to do initially was find space, right? So we took a lot of our conference room and meeting rooms because we weren't meeting in person, and we wanted to create that open space. There were a lot of behind-the-scenes pieces about when we would get our delivery, and for us it was actually, there's a long story that I'll make it short, but it was sitting somewhere waiting to get here, and we had to kind of chase it down, and we got it here on Christmas Eve. When we had people coming in and we were figuring out how to get it into people, the demand was very high, supply was very low, but we wanted to try to get that hope into people as quickly as possible. It was a little bit like people showing up for Beatles tickets, I would imagine, coming in through the parking lot, trying to get here during the middle of winter to get those done. And we had a lot of volunteers, a lot of people helping us to help people find the right way, to get signed up, to get their cards, to get their injection, and that teamwork and coming together and finding a process got streamlined over the next several months to the point where we're, I think, over 100,000 total shots given between first, second doses, boosters, and the like. So it is something that we're very proud of as an organization. There was an article recently in the paper with one of our pharmacists who was very intricate to that, but there were many other people that were very important to that, a lot of volunteers, people that just came down to try to help. So that was how that all happened, and we hope that we can continue to provide that service in whatever way we need to do it, but in a slightly different way.
And Dr. Kelley, some folks are kind of saying these days, we're seeing the light at the end of the tunnel. As a doctor, were there ever days during the height of the pandemic that you thought we'll never see the light at the end of the tunnel?
Well, I think that the issue for me was always something different. I think that the virus itself and the peaks and the valleys, the waves, in reality, there are probably about 5 different waves when we sort of sort out the pieces, but there was always something different. One day we would feel like we would be doing very well, and we knew we needed to continue to try to get people cared for, get them vaccinated, get them treated in the emergency department, get them admitted, get them the right therapies. But some days we wouldn't have, enough tests, and we had to sort of go right down and figure out how we're going to. Some days we didn't have enough supplies. Some days we wouldn't have enough staff. So there were all of those pieces that tend to create an additional barrier or hurdle for us that did make it feel like we were on sort of this never-ending roller coaster. I think whenever we get into the valley like we are now, for instance, this morning in the hospital, we have only 2 COVID patients in isolation. We have none in our critical care unit and a total of 5 in the hospital, meaning 300 other individuals are just here that have had COVID, are still in the hospital, but are not isolated, are felt to be infectious. When we've gotten to that level, we hope that this lasts and gives us a nice break or a respite from all of this, because it is not, sustainable to continue. So there were times of like, how are we going to, as healthcare workers and as a team, be able to continue to do this if it doesn't go away? And I think you would probably ask yourself that question, and then you'd move on to the next task at hand and do your job. Purpose was a very important part of this for all healthcare workers, why you went into healthcare. A lot of that is purpose-driven work, servant leadership in my role as well, that those are the things that you sort of ask yourself that question and say, what if this doesn't go away? And then you move on and you deal with the next thing in front of you. So there were times, but I think right now, while we're in this valley, we don't want to speak about those too much.
Well, we certainly understand. Thank you for all your hard work. We appreciate your time this morning, Dr. Kelley.
Yeah, thank you.